Hi, I'm Jessica Catlin. I'm a mental health patient and also a cancer survivor. I recently wrote a book called Full Circle: How Politics, Depression, and Yoga Helped Me Crush Colorectal Cancer in Crisis. I was diagnosed with depression and anxiety in 2008, but I didn't tell anybody because I was in Arizona planning to run for office and I didn't want that stigma attached to me. But then in 2011, Congresswoman Gabby Giffords was shot by a man whose mental health diagnosis had been swept under the rug. 6 other people died, and it was on that day I decided to start talking openly about mental health. I went to social media and spoke my truth, and you know what happened? A lot of people came out of the woodwork and they shared their experience with me. A lot of people started telling their own stories. And really, that was the most important public service I could possibly do. I have the distinct honor of being a mental health patient and a cancer patient. And I can tell you there's huge inequity in how we treat cancer versus how we treat brain diseases. When I was diagnosed with stage 3 colorectal cancer, I had a plan, I had a team, and this all happened even before they told me what was going on. But contrast that with my experience as a mental health patient. I've had to be my own quarterback of my own treatment for more than 10 years. The reason that community health centers are so important is because they provide comprehensive services. They are there to help you create a plan. One of the most important things we can do to end the stigma is to stop using victim blaming language when it comes to mental health and substance use disorders. When we say things like crazy or addict or commit suicide, we are blaming the person who is sick. We don't do that with cancer. As a matter of fact, for a long time, I avoided my issues with addiction because I did not want to be called an addict. If only there wasn't so much shame around the word addict, maybe I would have gotten help a lot sooner. It is so important to support community mental health centers. If you've never had a mental health diagnosis before, you may not know it's really hard to get in to see a therapist with insurance. It's really, really hard to get in to see a psychiatrist with insurance. And if you are using Medicaid, it's almost impossible to find somebody who will accept that insurance. I had that experience one time. But community mental health centers are there to provide access and equity for all who are seeking mental health treatment. And that is why it's so important to support places like Jocelyn that are really moving towards mental health for all. I do a lot of different things to take care of my mental health, and I talk about it in my book, Full Circle, because it was such an important part of my success as a cancer patient. Whether it was taking medication for depression and anxiety, or getting enough sleep, or eating good foods, or going to yoga, engaging in mindfulness. These are all very important tools that I learned as a mental health patient that really helped me succeed when I was going through chemo and radiation and surgery. I'm Jessica Catlin, and this is my Take 5 for mental health. If you are experiencing a mental health challenge, need support, or know somebody who does, please visit the Jocelyn website. If you'd like to learn more about my book, Full Circle: How Politics, Depression, and Yoga Helped Me Crush Colorectal Cancer in Crisis, please connect with me on LinkedIn or on Twitter.